So Dr. Gies had a call for action, which included a number of things. But two that I'd like to point out is one is that he felt very strongly that dentistry needed to move from a preceptorship model of education to an academic field of study. And the other was to ensure an adequate number and distribution of dentists throughout the country. Right? Here at Rutgers School of Dental Medicine, we take both to heart. From the standpoint of the academic field of study, we have taken the issue of cultural competency and made it a core piece of our curriculum.
Here, Dr. Chaviano and Dr. Perez, they're paving the way for future generations of leaders and students, so they feel more welcome and they feel they're safe in this environment.
The work at the Rutgers School of Dental Medicine, led by my colleagues, Dr. Rosa Chaviano-Moran and Dr. Emilio Perez, signals to the nation that dental education and practice are responsive to demographic shifts and strive for inclusivity of all individuals, and particularly the LGBTQIA community.
Coming from an undeveloped country, which is Cuba, where I lived 27 years of my life, being judged, being bullied for who I am, now at the school, now I feel that I'm safe, that I'm not going to be judged, I'm not going to be pointed out because of my sexual orientation.
So my greatest source of pride of the work that they do is looking at the number of people that have been influenced or have been touched by their work. So if you think about the curriculum development and the students that they've helped educate, there's literally hundreds of them. And each of those students have literally touched hundreds, if not thousands of patients, which means literally hundreds of thousands, if not millions of people have been impacted by the work that they do.
Without question, the Rutgers School of Dental Medicine serves as a role model for what others can do. Their work formally acknowledges that excellence and diversity go hand in hand.
So the environment here that has been created at the Rutgers School of Dental Medicine, we believe, is second to none. But it is about creating that environment where they feel comfortable talking about any issues that they may be having, sharing experiences, being a part of each other's lives. Those are all things that enable Rutgers to be a very special place.
Thank you so much. I'm proud and humble to accept the Gies Award for Vision in recognition of Rutgers School of Dental Medicine's commitment to diversity, equity, inclusion, and educating the dental community about the needs of the LGBTQ+ dental students, faculty, and patients. There are still system policies and practices in dental education that do not support sexual orientation and limit gender expression. We must convey to LGBTQ+ community members that they will be safe, accepted, and able to thrive in our environments.
I want to thank Dean Cecile Feldman and Vice Dean Kim Fennessy for supporting our initiatives and efforts to make Rutgers School of Dental Medicine a diverse and inclusive environment in which members of the LGBTQ+ feel accepted, respected, and valued. I want to thank everyone that believed in us from day number one, in particular, Dr. Sonia Smith, Chief Diversity Officer at ADIA, for providing us the opportunity to share our knowledge with others. A dental school is not complete without dental students, in particular those ones that are committed to pursuing their education while having the courage to ask for change and make themselves visible. I want to thank all of our students for entrusting their educational experience to Rutgers School of Dental Medicine. I am humbled and thrilled to be included in this recognition. As a dental educator, I want to thank the ADIA Gies Foundation and the supporters of the foundation for this honor. Thank you very much. Muchas gracias.
Diversity creates educational excellence. I would not be standing here if it were not for the students. This is for you. I hope to lead by example. There's still a lot of work to be done. Thank you.